Hello everyone, and welcome. Today, we are going to talk about something many of us have experienced, especially when we were younger, a sore throat that just won't quit. I'm talking about tonsillitis. But before we dive into what goes wrong, let's first understand what our tonsils actually are. Think of them as two little guards standing at the back of your throat. They are small, oval-shaped pads of tissue, one on each side. Their main job is a very important one. They are part of your body's immune system, your personal army that fights off germs and keeps you healthy and strong every single day. So, what exactly happens when you get tonsillitis? The word itis at the end of a medical term usually means inflammation or swelling. Therefore, tonsillitis is the medical name for when your tonsils become inflamed and swollen. This happens when those two little guards get overwhelmed by germs like bacteria, or viruses. They try to fight the infection, but in the process, they become infected themselves. That battle makes them red, puffy, and very sore, like trying to swallow a lump of spiky rocks. Remember, inflamed tonsils mean they're doing their job. They're trapping germs to stop them spreading deeper into your body. Still, it can be incredibly uncomfortable and make you feel unwell. It's very common, especially in children and teenagers, because their immune systems are still learning, encountering germs at school and at play. So, if you or your child gets it, you are not alone. Understanding this process is the first step to dealing with it. Tonsillitis isn't mysterious. It's your body's defense in action. The inflammation is the immune response as your tonsils work overtime to stop invading germs. That's why they swell and turn that angry shade of red. Now that we know what tonsillitis is, let's talk about what causes it. The culprits are usually tiny invaders called germs. Viruses, bacteria. Most of the time, tonsillitis is caused by common viruses. Common cold flu. That's why a sore throat often comes with runny nose, coughing, sneezing. Viral tonsillitis spreads easily, especially in schools' offices. The other group of germs is bacteria. Streptococcus pyogenes causes strep throat bacterial. Tonsillitis can be more severe. Treatment is different. Doctor can do a quick throat swab test. How do germs get to your tonsils? Cough, droplets, sneeze. Droplets talking, droplets breathe in, droplets landing on tonsils. Touch a contaminated doorknob. Touch a contaminated tabletop. Then touch your face, mouth, nose. This is why washing your hands frequently is one of the best ways to protect yourself. So your tonsils are under attack. How would you know? Your body will send you some very clear signals. The most obvious symptom is a very sore throat, not just a little tickle. It's severe and makes swallowing a real chore. Even swallowing saliva can hurt, so people often avoid food or drink. Look in the mirror and say, ah. You might see red, swollen tonsils. You might see white spots. You might see yellow spots. You might see patches or exudate. Along with the sore throat, you may feel generally unwell, like having the flu. A high temperature, a fever, is common. You might feel shivery or alternate between feeling too hot and feeling too cold. Headaches often come with it, making you feel run down. Many people complain of an earache. The throat and ears share nerves, so pain can travel and make your ears hurt. Check your neck. Lymph glands may be tender and swollen. These are lymph nodes, part of your immune system. They swell as they filter out germs. Your voice may sound different. It could be hoarse, it could be scratchy, or it could be muffled. When tonsillitis strikes, your first thought is probably how to get relief from that painful throat. There are many simple, effective home things to make you more comfortable. First and foremost, rest is your best friend. Staying home from work or school, avoiding strenuous activity, getting plenty of sleep. Rest lets your immune system focus on getting you well, which can speed recovery. One of the oldest remedies is gargling with warm salt water. Dissolve half a teaspoon of salt in a glass of warm water, take a sip, gargle at the back of your throat for about 15 seconds, spit it out. The salt water can help reduce swelling in your tonsils and wash away irritants, giving temporary relief. Drink plenty of fluids, caffeine-free tea with honey and lemon clear broths. Cold things help too. Suck on ice lollies or sip cold drinks to numb your throat. Soft foods are best: soup, yogurt, mashed potatoes, smoothies. Avoid hard foods, crunchy foods, spicy foods that could irritate your throat more. While home remedies are fantastic for managing symptoms, there are times when you absolutely need to see a doctor. If your symptoms are very severe, for instance, if you have extreme difficulty swallowing or breathing, you should seek medical help right away. When you see your doctor, they'll examine your throat and ask about your symptoms. They'll try to figure out if it's caused by a virus or bacteria. They might take a throat swab to test for streptococcus. Knowing the cause guides treatment. If it's viral, antibiotics won't help. Doctor will recommend rest, fluids, and pain relief. If it's bacterial, antibiotics like penicillin may be prescribed. Remember to look after your health, and for more tips, check out the Happy Health 10 channel.